First of all, congratulations, students. You have gone through one of the most difficult classes you've ever had, and you've had a tough last year and a half. I applaud your tenacity and your willingness to be flexible. Welcome to public health, and we're real proud of all of the work that you've done. This has been a tough class. I also want to thank Dr. Tahara and Coral Matar. The work that they put in, it can't be measured. The amount of work they've put in, and without Coral's help, this would have been really tough for Dr. Tahara. Keep in mind also that a lot of this work is done months prior. So thank you, Denise and Coral, for all of your hard work with that. And I also want to thank George Contreras and Ari Markinson. Apparently they've been pretty valuable for the class as well. Dr. Tahara, thanks for everything you've done with this group, and looking forward to the presentations.
Thanks very much, Dr. Kittleson. So because this is a class, of course, I have to have a couple of things to say before we get started. However, while I'm doing this, what I'd like to say is, first of all, if there are alumni here, if you're HPM alumni, please just put it in the chat and tell us what your project was. If you are just alumni from the School of Health Science and Practice, please just, we'd like to give you a shout out. Thank you, all of you, for coming. I know I saw a few names. I saw Patty Reynolds and Dawn French, who happen to have been on the same project. So that's for a few years back. So just quickly scanning. And also Professor Markinson is on the call, so thanks very much. So I'm going to just sort of walk you through what Capstone is. I'm going to just make a couple of comments, and then I, of course, have a slideshow. No class would be complete without one, right? So first, I also want to alert all of you that Wednesday and Thursday night, the other capstones from the other programs are going to be via Zoom. So on Wednesday night, we have we have health behavior and community health. And Thursday, we have both biostatistics and epidemiology capstones. So I hope you'll join us for those others. And a lot of us were already at the earlier one with environmental. So we've got a great week scheduled. So Capstone is the culinary applied research experience for MPH students before graduation. In Capstone, students have the opportunity to really integrate and apply the knowledge and skills they acquired in the program to real-time public health challenges and community stakeholders. They also have the opportunity to hone other skills such as project management, public speaking, and systems analysis. They create concept maps, flowcharts, logic models, and ideate the projects and develop solutions. In health policy and management, the students have the opportunity to really look through the lens of the patient or the user's experience and follow their journey. And that's the lens that they use to address the public health challenges and work with community-based organizations. Although this semester they didn't have the opportunity to work with community-based organizations, all 3 Capstone teams had the opportunity to work with stakeholders in the respective fields. Before the students present, I want to share with you a brief look at what our process was. The students used what we refer to as the 4D strategic design approach to their research. This approach enables them to really not be constrained by traditional boundaries and barriers, and also consider the impact on the demographics studied. It's a human-centered design approach where they start with empathy. And this requires the students to zoom out to really understand the ecosystem and the stakeholders and the context, and then zoom in to really address the specific problems. So what's Capstone? Gosh, a lot of people scratch their heads. I assure you it's not free-falling, although at times it probably felt that way. But in fact, Capstone is the last stone that holds everything else in place. And for the students, it's really all of the knowledge that they acquired in this program. It's also an opportunity and, of course, process. No course with me would be complete without a flow chart. So I want to briefly just sort of tell you a bit about what this process is, the 4D, which is called the human-centered design. So as you see, we have four stages: discover, define, design, deliver. You also see we have this divergent and convergent thinking. So the divergent thinking really is the place where we ideate. We sort of expand, explode, look at the market. No ideas are looked over. And each time we go through the divergent part, we then come back together with convergent thinking. We think about how we either apply what we learn or how we're going to measure it or how we can think about and structure this. So this is really an iterative and a cyclical process. And the goal is to really help tell the story about the public health challenge that we are looking at. So the discover is where you study the context, the ecosystem, what's working, what's not, where's there an opportunity. Define is really what is out there and why it's working, where there are gaps, where there are insufficiencies, and how will we study this problem. Design is what did we learn, now what? Where are some of the infrastructure needs? What are some of the next steps, actions, and innovations? So what's the purpose? Well, the purpose really is for us to develop creative leaders who can collaborate and innovate to solve real-time public health challenges. And what Capstone is not a shouting match or heavy lifting. Everybody participates equally. So where do we start? Obviously with public health, and there are millions and millions of public health challenges for us to study. The students start with a problem statement and then develop a research question. They also use literature both through the computer and also those are books for those of you who don't recognize what they are. They work on team building and idea generation, and they make connections to create a new narrative for the problem that they're studying. So they also conceptualize their project using whiteboard or whiteboard-like objects. Oh, sorry, that was Capstone 2021. COVID hit. So what does our process look like? From week to week, this became our reality, or maybe even a little bit of Hollywood Squares. What I'm showing you here is actually how we reset to collaborate in a virtual setting. We used a program called Miro, which is a collaboration tool. It's basically a virtual whiteboard. What you see here is how the students actually worked on their projects. So this is one of three. Each student has their own infinite whiteboard. And what you see are they have various frames and various diagrams, drawings, photos, things, all things that they would be using in their program, in their project. The really cool thing about this is that they can work on it in real time. They can be on a Zoom call, they can be on a telephone call. They don't even need to be in the same room, or they can work asynchronously. All of their comments, all of their changes are all recorded. And so when students jump back onto the whiteboard, they can actually see what messages were left to each other. I'm going to just briefly show you a video. Let's hope this works. Just part of the video.
Miro is a whiteboarding platform where your team can create, discuss, and share their work using the simplest tools. It fits right into your team's current workflow. They can add everything from spreadsheets to interactive prototypes to the board. And don't be afraid to run out of space. All you need to do is zoom out to see the big picture. To start a conversation, go to the collaboration toolbar in the bottom left. Suppose your colleague left a comment on the board. He wants your input on a visual for the project he's working on.
So you can see that the students can really work together or independently, and they really had the opportunity to use this to replace being in person. They also put their posters together for each one of the three projects, and these will be available in the breakout rooms. These will be available in the breakout rooms after our presentations. So I want to thank everybody. I want to thank our first responders and our healthcare colleagues and all those who supported the students at home with their projects, and enjoy the presentations. Last thing that I want to do right now is I'd like to just thank the faculty for their support and hard work and supporting the students throughout the program. I especially want to thank Professor Matar and Professor Contreras, happy birthday, by the way, and our chair, Mark Kittleson. Of course, behind the scenes, Cindy Jakubowski. A shout out to Taylor Gerber, who prepared all the marketing communications and who was just selected as one of 10 fellows for the prestigious John Solomon Fellowship for Public Service. Go Taylor, go you, thank you. I also would like to give a shout out to Mike Crowder and to Educational Media, especially Mike Frankfurter, who helped students with their visuals. And I'd also like to take a minute for us to remember our friend and educational media specialist, Christian Sheridan, who left us too early. Our condolences to his family and to his friends in educational media. Chris, you were definitely missed this capstone and you will be missed. Thanks for joining us. Now I will turn the program over to our students.
Good evening, everyone. I'm Maggie, and tonight my team and I will discuss the Patient Protection and Affordable Care Act, one of the most important pieces of legislation that provides equitable access to healthcare for Americans. Throughout this presentation, we will refer to the PPACA as the ACA. The ACA has been challenged in the Supreme Court several times, and in the most recent, the constitutionality of the individual mandate is put into question. As public health professionals, it is important that we understand the public health implications should the ACA be repealed. We hope that with this presentation, we're able to bring some clarity to the issue at hand. We have a short video for you that highlights key elements of the ACA and addresses issues related to pre-existing conditions and the impact of COVID on specific groups. The Affordable Health Care Act was one of the most significant pieces of legislation in the history of the United States. Under the ACA, the number of insured Americans grew by 20 million. There are 6 benefits of the ACA. The COVID-19 pandemic has greatly impacted women in particular. In 2020, more than 800,000 women left the workforce due to the pandemic, compared to the 200,000 men. The financial burden on women leaving the workforce accounts for more than $64 billion per year in lost wages and economic activity. Leaving the workforce translates into a reduction of monthly income and spending on non-essentials. In many cases, healthcare is among the first to be cut. Making healthcare affordable and accessible to all women, particularly those hit the hardest during the pandemic, will be critical in ensuring positive maternal, child, and family health outcomes.
In 2007, I lost a job I had had for a long time. So what happened is I went from 2007 to 2014 without any health insurance. When you don't have health insurance, you're kind of nervous all the time.
Having access to affordable healthcare, having access to healthcare period are the #1 issue.
Come 2014, finally, I took advantage of the ACA. One of the reasons you need insurance is for those screenings, for preventative care.
Especially living in a metropolitan city where you have many low-income communities, you have public housing, you have people who don't have access to transportation. Most people will have a pre-existing condition. And so it's extremely important that any healthcare system is going to be taking that into consideration. It shouldn't even be a consideration. I mean, everyone has their own health background. And so what is a pre-existing condition in 2021? Thank you for watching. We explored the ACA through a 4D model, a framework that outlined the importance of the ACA. On your screen, you see an empathy map, which helped us answer the ultimate question of why preserve the ACA? Why do we care and who do we care for? An empathy map is a collaborative tool that public health professionals can use to gain a deeper insight into a population and their experiences within the healthcare system.
To truly understand our population, we needed to answer the following questions. Who are we empathizing with? What do they need to do? What do they see and what do they say? What do they do? What do they hear? And lastly, how they feel and think. The first step of the empathy map is identifying who our target population is. Pre-ACA, 46 million Americans were under and uninsured. Post-ACA, there were 29 million. With COVID, we can anticipate that the number of adults with pre-existing conditions will rise, many of whom will be denied care if ACA is repealed. The second question is, what do they need to do? The goal is to get the 29 million Americans purchase affordable health insurance, and here's why. The US has the lowest life expectancy compared to other nations in the Organization for Economic Cooperation and Development. US adults have the highest chronic disease burden, twice the burden of the UK and the Netherlands. Question 3 and 4 is what do they see and say? Healthcare is costly. As the chart here shows, the US spends the most on healthcare, particularly through private spending and out-of-pocket expenses. So what do they say? 50% of Americans fear bankruptcy due to health-related events. That number goes up if we're looking at non-white adults. Question 5 of the empathy map is what do they do? People do not utilize the healthcare system. Pre-ACA, 1 in 5 women reported that they postponed or went without preventive care due to cost. Americans visit their physicians far less than other countries. We have the lowest physician-to-patient ratio and one of the highest rates of hospitalization from preventable causes, 8 times higher than the UK and the Netherlands. Question 6 is what do they hear? We mentioned the legal challenges in the video and will further explain them in the presentation. However, as of this February, the court's new position is that the individual mandate is constitutional. No decision has been reached yet, but what people hear is that they do not have to pay a fine if they do not have insurance. But perhaps what people should hear is that adults lower their chance of premature deaths by 19% by visiting their PCP compared to adults who only seek specialized care when needed. And lastly, what they think and feel, which is truly in the center of both the empathy map and our ability to understand our target population. Accessibility and affordability are instrumental in determining health outcomes. There are 3 health initiatives that the ACA helps to advance: Healthy People 2030, the 10 Essential Public Health Services, and the Triple Aim. We'll discuss them later in the presentation. Anam will now explain the ACA challenges in further detail.
Thank you, Maggie. As you can see, the main challenges surrounding ACA can be divided into legislative and operational challenges. We will now talk about 2 of the most important cases related to ACA. NFIB versus Sebelius is one of the historical challenges to ACA in which the Supreme Court was presented with 2 major issues to resolve. The individual mandate, where uninsured Americans were required to purchase health insurance or pay a penalty, and mandatory Medicaid expansion. States had to expand their Medicaid program from 100% of the federal poverty level to 138% federal poverty level, otherwise those states would no longer receive federal funds for Medicaid. The Supreme Court ruled that the individual mandate was constitutional, but mandatory Medicaid expansion was not. Therefore, states had the option to choose whether they will participate in expansion or not. This case has provided framework for what is happening in the courts right now. In California versus Texas case, the Supreme Court is resolving 3 issues, out of which the most important, most relevant for the purpose of our research is whether the mandate with $0 penalty is considered a use of Congress's taxing power, since they aren't taxing or penalizing anything. This is an ongoing case and the Supreme Court hasn't given its ruling on the case yet. The ACA has presented several operational challenges involving enrollment, health insurance exchanges, healthcare waste, and Medicaid expansion. Despite the implementation of ACA and its essential provisions, the number of uninsured individuals remains alarming. The enrollment process for healthcare insurance is overly complex, and navigating the marketplace remains challenging to many Americans. The estimated cost of healthcare waste in the United States range between $760 billion to $935 billion, and savings from intervention that addresses waste were between $191 billion to $286 billion. Next slide, please. As the map shows, to date, 39 US states, including DC, have adopted Medicaid expansion under the ACA. And the rest of the states are analyzing their policies to adopt their Medicaid expansion. More than 2 million uninsured adults across the nation fell into the coverage gap in states that did not expand their Medicaid program. Interestingly enough, Texas was one of the first states to be interested in Medicaid expansion, yet they are one of the 12 remaining states as of April 2021 that have not adopted it yet. Not only that, the rate of uninsured population is highest in Texas at 18.4% as compared to the rest of the states. As you can see on the slide, most of the non-expanded states are in the southern region of the United States. For example, Mississippi is one of the most impoverished states that has the highest prevalence of certain chronic diseases and worse health outcomes as compared to the rest of the nation. Another alarming fact about these states is that they have highest prevalence of chronic diseases. For example, the mortality rate due to heart diseases in Texas in 2019 was 163, whereas in California, it was 136. In the light of historical challenges and ongoing Supreme Court cases, to what extent can the ACA be preserved and enhanced to best serve the population, which includes the under and uninsured patients, many of whom are living with pre-existing and chronic conditions? I will hand it over to Saravana now to discuss the impact of ACA.
As the US population continues to live longer, the likelihood that the individuals will develop a pre-existing condition also increases. Every day in the US, 10,000 Americans turn 65, and about 56 of these adults, 65 and above, have 2+ chronic diseases. 90% of the nation's $3.8 trillion, which is roughly about 20% of the GDP, is spent on the annual healthcare expenditures to cover for these people with chronic conditions. The top 3 chronic conditions in the US are diabetes, heart disease, and cancer care, which cost the system $327 billion, $214 billion, and $174 billion per year, respectively. Not surprisingly, Medicare pays for most of these services. The ACA sets an annual out-of-pocket limit from $3,000 to $8,500 for Medicare healthcare plans and marketplace plans. Without the ACA, average out-of-pocket costs could potentially increase for the individuals with a pre-existing condition, and this could risk millions of Americans from losing their coverage. Now, Sapna will discuss how the ACA has helped achieve the 3 most important health initiatives.
Many racial and ethnic groups are disproportionately affected by the pandemic, and Healthy People 2030 prioritizes eliminating disparities and achieving health equity with support from the ACA. The 10 essential public health services listed on the slide describe activities that public health departments can undertake to remove structural barriers that cause health inequity. As you see, the ACA has three goals known as the AAA, and improving population health and quality of the patient care and reducing costs is expected to improve health outcomes. This graph illustrates the impact of COVID on labor force participation. As you see, the employment rates among mothers of young children still remain very low compared to fathers of young children. Schools and daycare closures have made it more difficult for mothers to return to a full-time job, and many women who can't work remotely are either forced to take unpaid leave or stop working entirely. The graph to the right illustrates that if ACA is repealed, 1 in 5 Black and 1 in 3 Hispanics would be uninsured, proving ACA is needed to mitigate health disparities in the current context. Now, Mario and Rafael will speak on the public health implications.
Thank you, Sapna. 86% of healthcare spending in the United States is on the treatment of chronic conditions, but only 3% of spending is on prevention and public health. The ACA addresses important public health issues key to population health. This includes increased access to affordable health insurance and the reduction of waste and overspending. If we can shift the focus of healthcare spending towards more primary and secondary prevention, this will help reduce the incidence of newly diagnosed chronic conditions and help us meet the goals of Healthy People 2030, and ultimately lower the per capita cost of care in the United States. The ACA created the Accountable Care Organization, or ACO, and it gives the Secretary of the HHS power and flexibility to designate ACOs. Many ACOs adopt the patient-centered medical home and the health home model, and they improve the quality and value of care. ACOs also offer comprehensive services for patients over 65, many who bear the burden for pre-existing conditions in the United States. The ACO model and ACA provisions, such as subsidies for insurance enrollment and annual limits on out-of-pocket spending, will help us realize the goals of the triple aim and 10 essential public health services. I will now hand you over to Raphael.
Thank you, Mario. So what are the long-term challenges? Limited access to preventive care services, often due to lack of insurance or undercoverage, is a major issue impacting the long-term health of vulnerable populations. As a result, millions of patients suffering from undermanaged chronic diseases suffer complications and further deteriorating health, leading to increased emergency room visits. Next slide. By making preventive services more accessible and affordable, the ACA helped bridge the gap between disease prevention and treatment. It expanded coverage for evidence-based screening, immunizations, preventive services for children, adults, and women. The ACA also supported expansion of primary healthcare professionals in shortage areas through scholarships and loan forgiveness. It also funded 10% bonuses and other financial incentives for primary care physicians who participate in the Medicare program. Next slide. In addition, the ACA supports development of community healthcare worker programs. Their close relationship with community members enables patient outreach, health education, and social support. Community healthcare workers have been shown to positively impact health outcomes and overall cost of care in three main areas: securing access to healthcare, coordinating timely access to preventive healthcare services, and helping patients manage chronic conditions. Community healthcare workers can also help reduce cost and utilization of emergency care and preventable hospitalizations, especially in communities burned by high rates of chronic illnesses. An example of a successful program is the Arkansas Community Connector Program, where the use of community healthcare workers demonstrated a 24% reduction in annual Medicaid spending and a net savings of $2.6 million in 3 years. Now my colleague Moyo will discuss ways to preserve the ACA.
Thank you, Raphael. As we have discussed, the ACA has helped bridge healthcare disparities. It has narrowed racial disparities in access to care. ACA has increased the number of insured Americans by 20 million and protected more than 54 million with pre-existing conditions. The court decision later this year will further determine access to care for millions of people, which has become even more important during this COVID-19 pandemic. Based on our research, we have concluded that the only solution is to uphold the law. Preserve the ACA, do not repeal it. But we cannot predict the outcome of the legal cases. We explored ways to prevent the causes of the spiral in healthcare costs, which makes it unaffordable to begin with. We recommended boosting health insurance enrollment, reducing healthcare waste, improving healthcare delivery system and interoperability, and Medicaid expansion. The enrollment process for health insurance is very complex, and navigating the marketplace remains challenging for many Americans. We recommend improving access to the marketplace, expanding the workforce by hiring more enrollment specialists to provide individualized enrollment assistance, identify social determinants of health that are barriers to enrollment, and expand media outreach to address lack of awareness. As Anama's mentioned, healthcare waste accounts for 25% of healthcare expenditures. This pie chart shows us the 6 major causes of healthcare waste. We looked at administrative complexity, which is the largest of all, and overtreatment, which is the lowest, as ways to save money. Exploring effective measures to eliminate waste presents us an opportunity to further save money. So we recommend implementing evidence-based guidelines to reduce low-value testing, elimination of administrative burdens, allocating resources to improve healthcare data interoperability, which enhances patient care, promotes safety, and improves healthcare quality metrics. Havnit will further explore healthcare interoperability, care delivery, and Medicaid expansion.
Thank you, Moyo. So our next section in Deliver is healthcare delivery system. The healthcare delivery system under ACA aims to support the system change along with balancing market changes and population requirement, but it has to be in a financially stable environment. So under ACA, more and more focus is now transitioning care from hospitals to outpatient settings, strengthening data privacy, increasing transparency in care, and technologically advanced care. So more focus is now on value-based care and not volume-based care. Next slide. As you can see in this graphic under ACA, the focus is on value-based care. On the left, you see the focus is on improving quality, and on the right, you see the focus is on also reducing the overall cost. This can be achieved by using evidence-based guidelines in patient care, episode-based payments, reducing preventable readmissions, and value-based purchasing. The best example shown in this COs, accountable care organizations, as previously mentioned, it addresses quality of care and also cost of care. So our recommendation is strengthen the existing ACA's healthcare delivery system, both financially and operationally. We're going to move now to healthcare interoperability. ACA aims to enable the robust development of US healthcare infrastructure. Value-based healthcare would not succeed without the use of standardized interoperable healthcare information exchanges, commonly called as HIEs, that use up-to-date healthcare information technology, data analysts, and report generation capabilities. For example, SHIN New York, statewide health information exchange for New York. Use of SHIN New York to access patient information is associated with approximately $160 to $195 million annual reduction in unnecessary healthcare spending, including significant savings to Medicaid and Medicare. Healthcare interoperability also helps in track the development of chronic diseases. It also allows for the efficient allocation of resources and healthcare solutions, thus reducing administrative cost. So we recommend a national expansion of interoperability and healthcare information systems. We're going to now talk about Medicaid expansion. As previously mentioned, states that expanded Medicaid not only saw a reduction in the number of uninsured, but also saw a decrease in the number of people who owed healthcare debts. States ended up with net savings as the federal government paid a good chunk of money for Medicaid expansion. So we recommend federal government to provide enhanced medical assistance percentage to states who decide to expand their Medicaid programs, and to provide grants to states who have already expanded their Medicaid programs. So we concluded ACA significantly reduced the insurance gap and also healthcare racial disparities. It helped people with pre-existing conditions, providing care to millions of previously uninsured and underinsured Americans. If ACA is repealed, there's no other policy in place to replace or mimic its impact on population health. Therefore, repair and strengthen ACA, do not repeal it. Here are our references in next slide. And thank you for your time, and special thanks to our mentors and stakeholders, and a big shout out to all the moms out there. Happy Mother's Day. Thank you.
Thank you very much, team 2.